Hi, I'm Dr. David, and this is your ADD ADHD video blog. Second installment. Have you ever wondered if you have ADD or ADHD, or perhaps you wonder if your son or daughter might have it? Well, what do most of us do? Well, most of us will call our family care physician, or perhaps a psychologist, and we'll go in and have the child or myself, if I'm the adult, tested. The problem is that there is no test for ADD or ADHD. It's all diagnosed through observation, and most of the time that observation is incorrect. Well, why is that incorrect? Why? That just doesn't make sense to me. Well, it's incorrect because it is done totally by observation, and the standards within DSM, which is the diagnostic manual, are so broad that it can literally apply to anyone. So what's it like to be with ADD, ADHD, or to have your son or daughter with it? Let me tell you what it's like for them. Imagine that I take you into the busiest, biggest casino that you can imagine. At their busiest time. I mean, you can't get another person in with a shoehorn. You have hundreds of thousands of bells going off, lights flashing, multicolored carpet, people bumping into each other. You hear rumblings of people talking back and forth. And while you're there, I take you right to the center of all this, where you're right at the epicenter. Everything is coming right to you. And I put you on a stool with a clipboard and a 20-page test and tell you, you have to complete this test in 20 minutes and you have to score a minimum of 90% to pass the test. Sound a little unfair? Well, that's what it's like for the person with ADD and ADHD every single minute of every single day. Needless to say, it's easy to get distracted because you've got so much coming at you all the time. When this is added with the fact that everyone with ADD, ADHD is above average intelligence, they usually test out at the genius level or above. They grasp things very, very quickly. They have a tendency to talk very, very quickly. And sometimes they're a little impetuous. They're a little, well, I'm not going to say that they don't think things through, but they're impulsive. Something seems like a really good idea, and most of us would look, oh, it's not a good idea. But to them, it seems like it's an okay thing. Why? Because they've analyzed it using a different set of parameters than what we would normally analyze. So when you've got this, what is the whole real problem? The problem is in class, the teacher says something and they've got it. They've got it the very first time the teacher says it, and then they're ready to move on. But the teacher doesn't move on. The teacher repeats it and repeats it and repeats it and repeats it and one more time repeats it. Meanwhile, the child or the adult is bored. They're ready to move on, and so they start finding other distractions. Well, not really good for academia. But the gifts of the person with ADD, ADHD are this. They are phenomenal at grasping people, names, faces, dates, solutions for anything that interests them. It has to be practical. They have a tendency to get lost in their heads because what they imagine or visualize is more real than the real situation that they're dealing with, i.e. the classroom. Well, the reason they're doing that is because they are expanding their mind. What would happen if? And if I do this, what are going to be the results? These kids will know. They'll have it figured out. So we have to challenge them. Well, how do we challenge them here as a hypnotherapist? What is it that I do that amazingly and miraculously removes all of the symptoms of ADD, ADHD? They never have to be on medication again. As a matter of fact, a lot of times our medical doctors actually reverse the diagnosis and say, no, it was a misdiagnosis. The child never did have ADD, ADHD. And they say that because DSM says that there is no cure for it. Well, what is it that I do? Well, first of all, is I teach them how to focus. And how do I teach them how to focus? Well, I've got this handy-dandy little thing right here. It kind of looks like maybe a cute little hat that maybe goes on or something like that. And that's really what this is. This is a device that fits to the head. And this is a neurotransmitter. What do we do with a neurotransmitter? Well, I set you up in front of another device. This other device is specifically calibrated to work on the same frequency as this neurotransmitter through Bluetooth. So what's it doing? It's picking up my brain waves. And basically, I teach the ADD, ADHD subject how to focus and how to relax and how to know the difference, because most of them don't. As a matter of fact, most of us don't. So anyway, I teach them how to relax. Now this sounds pretty easy. It's a lot more difficult than you think, and we're going to kind of get down into that in a couple of minutes. But anyway, getting back to it. So I use this little neurotransmitter, and what it does is it syncs up to a machine that has a fan in it, and the fan has a ping pong ball, and I have the person focus on where I want the ball to go. Level 1, level 2, or level 3. And depending if they're focused or if they're relaxed determines how high or how low the ball goes. When they get totally distracted, the ball drops completely to the bottom. So in a couple of moments, you're going to see some things that are going to be really interesting. But you're going to see two subjects. One of them is me, of course. The other one is an actual client. And what you're going to notice is that the client is having trouble making the ball rise and fall. So much so that they even ask, is the machine really working? Can you do this? Is it possible? Remember, there are no wires, there are no anything holding this. So what we have is we have a person sitting there, and you have to control your thoughts. And let's take a look and see what that really looks like from both the side of the subject that's not being real successful with it, and then the side of the subject that is being more successful with it. As we begin seeing our first subject, Nancy, sit down at the device, and you can see that the neurotransmitter is affixed to her head properly. And she begins. She's focusing on the ball. And what she wants to do is she wants to rise, or make the ball rise, to level 1, which is at that first level, the first marking that you can see there. And she's having a bit of a problem with it. Now the secret to this is to focus, but you have to balance the focus with relaxation. So by balancing this, she can actually control how high the ball goes up and how far it drops down without ever touching the bottom. Now, to be fair to Nancy, this does take a bit of practice. It's not something that you pick up today in 3 minutes or 4 minutes and just can go all the time. This is really controlling your mental processes. You're really in control of your brain. And if you keep using this type of device, and there are others out there, what you end up with is the ability to focus at a moment's notice, totally shut out all distractions, and come up to the conclusions that you're looking for. And when that's done, you return to normal, where you have the normal distractions and things like that. So as you can see, Nancy is having a little bit of a problem here. But as she continues, she starts to voice her opposition just a little bit. Does this work or not? And in a couple of moments, you're going to see that I come in and I show her that indeed it does work. Now we're going to have the opportunity to see what happens when I sit down and I begin to work with the neurotransmitter along with this little device that is connected directly to a fan, and it will allow the ball to rise and fall. Now keep in mind that I do this on a fairly regular basis. It's not like I do it for hours and hours and hours a day. I don't. But as a subconscious behaviorist, the one thing that I have learned is the power of the subconscious mind and the absolute power in controlling one's thoughts. So as we go with this, you can see that I am levitating the ball to different heights. I'm also dropping the ball down to different heights. And to be very honest, I'm doing my best to keep the ball up. Now, am I always successful as that? Of course not. Sometimes I do get distracted. And if you're ever working with a device like this, one of the things that you will notice is that when you get slightly distracted, and I'm talking a nanosecond, that fan shuts off and that ball drops immediately. So that kind of gives you an idea of what it is that we're playing with. It's pretty amazing, isn't it? Well, so the big question that probably most of you are asking is, what does this guy do that's so miraculous that all the symptoms of ADD, ADHD are gone? The simple answer to that is all of the symptoms of ADD, ADHD have a correlation or a similarity to the same symptoms that happens to a person when they're in hypnosis. So what I do is I put the client into hypnosis. While they're in hypnosis, I'm working on the cognitive behavioral therapy of less impulsiveness, focus, relaxation. But at the same time, I also give them the suggestion that they will not become hypnotized again until once again they are in my chair and they hear me say certain words. So what does that mean? Well, that means that normally we go into hypnosis just from the screen flicker when we watch television or we're on a computer. We also go into hypnosis when we're operating a cell phone, we're texting, or playing a video game. So what happens? Well, now they won't go into hypnosis anymore. So they're not going to lose track of time when they're watching TV, playing video games, or texting. So you start beginning to get less impulsive behavior, more the type of behavior that as parents we're looking for, or as employers we're looking for out of our employees. But the greatest thing out of all of this is that it is quick, effective, easy, and once it's done, it's permanent. That means they never have to come back in for kind of like tweaking and follow-up, which really makes us extremely cost-effective. A psychotherapist once told me that my complete treatment from A to Z costs less than her to sit down there and do an evaluation. So it is very cost-effective. Anyway, this is Dr. Dave. I look forward to talking to you again on our next ADD, ADHD video blog. Have a great day. Bye.